Hi, my name is Dioneila Valderrama, and I'm doing the week 7 assignment. I'm going to be talking about diabetes. In my assignment, I'm going to talk about introduction, what is diabetes. The second part will be types of diabetes and how people cope with the disease. The third part will be treatment, resources, and technology. The, the fourth one will be the conclusion, and then my reference. Diabetes is a medical issue that alters the body's glucose utilization. In a healthy body, whenever you eat food, that food, after being broken down and absorbed, causes a rise or increase is an increase in your glucose or sugar levels. After this, the pancreas secretes a hormone called insulin to reduce the sugar levels in the bloodstream. The issues with diabetes are increasing day by day, and currently is the seventh leading cause of death in our country. If you can see, diabetes don't have an age. It can happen to a child, or it can happen to an adult or an elderly person. Um, it don't have gender or economic barriers. Anyone can become diabetic if you don't follow a good diet or exercise or follow a healthy way of life. A study shows that diabetes is increasing for individuals to suffer from that they can suffer from cardiovascular, cerebrovascular, and peripheral vascular disease. Also, is retinopathy and nephropathy, and some of disease related with the diabetes. We had different types of diabetes. We had type 1, is an autoimmune disorder characterized by the abrupt onset of symptoms, which result from lack of insulin production by the beta cells of the pancreas. The type 2 diabetes is one of the most common chronic diseases in this country. Patients with type 2 have to follow a very close diet, oral medications, and insulin they need to be monitored, and patients with type 2 diabetes have have many disadvantages because they need to be careful what they eat, no trying to stay away from smoking or alcohol. They need to exercise more and follow a good diet. Also can have disadvantage of have problems with neuropathy, which affects the nerves in the hands and feet, and if they do not take care of themselves, they can lose their feet, they can lose a toe, they can lose a hand, fingers. They can. This is where amputation become a little kind of sad for them because they are not following the recommendation. It's very sad to have to experience this type of disease. Um, If you can see in the next slide, a person that is affected by the diabetes, especially her vision, it can happen if you don't follow the good recommendations. And also, we've seen too, somebody is trying to apply their or learning how to apply the insulin. We have a lot of patients in my office that we help them how to teach them how to apply their insulin, what are the best places in the body to do it, like in the abdomen area to pinch and then count to 10, make sure that they don't release the syringe too fast because it still is applying the medication inside your body. So all that you have to teach them. In the next slide, we'll see the different types of diabetes, type 1, type 2. They continue with the insulin or oral medication. and you can see it don't have no age. And also on the side you see the type diabetes, how can attack your body, the different type of organs that can be attacked. You can have diabetes can attack your eyes. Diabetic can have problems with their feet, the kidneys. You can have the nerves, which I explained before, neuropathy. You can have a stroke, even in the brain, and you can have heart attack, and you can have some other nerve issues with diabetes. Treatment and resources for diabetic patients. By following good care management behaviors, it can help to improve diabetes prognosis and reduce risk of long-term complications. By following a good and balanced lifestyle, there is so many types of information for diabetics out there. There is so many resources that they can find, um, understand diabetes a little better, and to learn how to cope with the disease. As you can see on my next slide, um, there is so many ways of, sorry, this is the next slide. They teach you how to take care of your feet when you have diabetes. There is so many patients don't know how to do it. So there is a lot of information that they can take home and they can read. And if they don't know how to read, they will have somebody in the family that be able to help them read the information so they can understand better how to take care of themselves. The other slide, you can see there is so many type of glucometers out there. uh, there is uh, how to apply your insulin, and if you're not taking insulin, how for you to manage to make sure you're taking your medication when it's time to take the medication. There is a lot of patients sometimes don't follow that, and they create more issues with the diabetes, because then they, instead of have type 1, they're going to start by getting into have type 2 diabetes. In this slide, you're gonna I'm showing the different type of monitors that they're now at advanced technology they have, that you be able to carry in your body, and it gives you your sugar levels. And then you see how in the other slide how they teaching how to apply your insulin. All these methods, we have it in our clinic. We help the patients to understand better how to manage their care, and I think it's very important they can learn how to become more self-confidence on the diabetes issue. It's very important to follow a good diet and also to follow good exercise. I think by putting in place a kind of like a calendar or something for you to remind that this is the way I'm going to do, follow follow my good plan for the exercising. I think is one of the best things to do, because I feel exercise keep your body healthy, keep your body in shape, keep your body energetic. And I think a person that has diabetes, by doing this, not only is keeping themselves healthy, but there are some obese patients that they need the exercise, and this will help them with lowering the calories or lowering their body weight, and that way they don't have all the issues. So exercise is very important for diabetic patients. The advanced technology for diabetic patients is one of the most important part, with from patient to provider, or from patient to nurses, because there is so many so much technology out there for them to use, but they, because they don't know how to do it. So that's why when the patients come into our clinic, we tell them all the types of resources that are there, and we teach them how to use them. So instead of the patient come to the office for a checkup or for maybe the sugar is high, they can also just get the in the computer and open the patient portal, and they be able to talk to the provider, and the provider be able to do recommendations or adjust their insulin or adjust their medication, or if they had any other problem, the provider will be able to address that at that time. So they don't have to wait for an appointment. And these are the good things about technology, because it, it monitor the patient better, and not also better, but you be able not to have the stress uh, issue of coming to the office or going to the hospital. So you can follow recommendations through computer. In this slide, you can see the the patients be able to use any type of cameras or videos or information, the resources that are there for them, and that helping to monitor better and have it type of communication with the staff or the providers as far as their disease. In this slide, you'll be able to see if the patient goes to the urgent care or go to the hospital, the doctor will be able to track that patient and see what symptoms he having or what is need to be done to make his blood sugar levels back to normal. So this is one thing of technology that is uh, so cool to have for them to have, because that way they be able to communicate with the clinicians. My conclusion for this PowerPoint is that um, our results suggest that diabetes management, self-efficacy, and something largely ignored in current early educational interventions is highly associated with blood glucose control. There is so many things or issues that it needs to be researched. Diabetes is a very long exposed disease, and it's got so much that we need to get better to help those that has diabetes. And I think that further promoting management and better care for the patients is one of the effective strategies that we have for our patients. I feel like there is so many things that we need to get better. We had to make sure that we can get better with patients as far as information, uh, treatment, and counseling is one of the best and most important things right now, because most of the time the patient needs that time to ask questions, to be listened, and sometimes the providers are a little busy with other things in the clinic. And I think that most of the time nurses, LPNs, RNs are that is their that is our job, to make sure that those patients understand better their disease and how to manage and how to cope with it, and help them understand better how to use all those resources that are out there. So that concludes my PowerPoint in diabetes, and I hope that if you have any questions or you wanted to get back with me on this, I will be able to. Thank you very much. Oh, so that we conclude, but I forgot that they had two more slides. I just want to let you know that attitude is one of the best ways to battle anything that you can face in the world. Attitude is energy, is power, is confidence. When you have that, you have everything. You'll be able to solve anything, and you won't be weak. Having an attitude to toward illness, disease, or any type of frustration we have, attitude, good attitude is the best thing, the best medication. And having on my next slide is to make sure that you always inform your provider or your clinician or physician about the status of your health. It's very important that you keep that communication open, and it's good that you have a very close communication with your doctors or nurses, and that way you'll be able to communicate better and understand better the type of your illness or what you're going through. So it's very important. Keep the communication, keep the attitude. Thank you.